In the headlines, 5 women and 7 monarchs among 30 to compete in the first ever virtual calypso semi-finals. Dominica praised by the Pan American Health Organization for its efforts in the fight against COVID-19. And legal practitioners told to embrace court mediation as a way of enhancing the delivery of justice. I'm Andrea Louis with the Channel 5 News, back with the details after this.
We are strong, we are resilient, and we will get through this together. But these are stressful times, and it's important to also practice good self-care. It's normal to feel overwhelmed, anxious, or afraid, but there is hope. Reach out to someone, connect with your friends, stay in touch with your community, and know that you are not alone. We're in this together. This is a public service announcement from the Dominica Red Cross.
Flow helps you stay connected to what matters. Simple plans and a better network mean that you can enjoy 7 days of unlimited social messaging, 3 gigabytes of reliable data to use as you like, 700 local anywhere calls and texts with the always-on prepaid plan, all for $29. Keep your number when you switch to Dominica's most reliable LTE network. Buy wherever you top up. Switch to Flow. It only gets better.
Thank you for staying with us. First up, 5 women, 7 monarchs, and 1 foreigner among 30 to compete in the semi-finals round of the first ever virtual calypso competition. A total of 43 artists submitted entries via CD, and after the selection process, the 30 who have made it to the semi-finals are Nashelle Walsh, stage name Nashelle, Nicole Abia Christian Alfred, Shirley Lady S. Charles, Alicia Ducre, stage name Alicia, Tasha P. Peltier, also a former monarch. The other monarchs are Gregory Caressa Rivera, Davidson the Observer Victor, Denison Dice Joseph, Derek De Hunter St. Rose, Darrell De Bob, and reigning monarch Jude J.D. Deloney. Rounding up the semi-finalists are Bingo, Mighty D, Triumph, Mighty Omi, Sawa, The Great White, Trinity, Inciter, Hakesy, Shadow Flow, Checo, Son of Saint, Danyan, Checker, Al Kazimi, Picklock, Genius, Lugas, and The Oracle. From these 30, 15 will be selected to participate in the grand finals on 13th February. In more top stories, Dominica has been praised for its efforts in the fight against the COVID-19 pandemic. The commendation is coming from Director of the Pan American Health Organization, Dr. Carissa Etienne.
I probably have not sufficiently complimented Dominica on the work that it has done as far as addressing the pandemic. You have made me proud. I think you've done a tremendous job. I believe that the leadership at the highest level, the leadership at the Ministry of Health, and the healthcare workers themselves and other first-line workers are to be complimented, but also the general community. And so my congratulations to all of you. And parting words, let's keep fighting the COVID-19. It is not over yet. So do not let your guards down. Let's do the things that we know how to do best. And the public health measures that have been spoken, talked about, and that you know very well.
In more developments, Director of the Pan American Health Organization, Dr. Carissa Etienne, says government's plans to improve the management structure of the National Hospital will help modernize the institution. The new Hospital Management Authority bill to be taken to Parliament soon is expected to restructure the hospital's management, improving efficiency and quality of service. The PAHO director, who was a guest on the Prime Minister's program, Anu Pale, on the weekend, says the proposed new hospital management system is a better model if executed properly.
I like to characterize it as bringing the management of the hospital into the 21st century. If I recall, we had this triumvirate with a hospital medical director, a hospital administrator, a matron, each of those reporting separately with separate reporting lines, and that certainly does not lend itself to good management, to accountability, or to efficiency. I think a CEO who has overall responsibility for the management of the hospital, with full authority for enforcing policy and the fiduciary responsibility, accountability, and human resource management will be a better model as long as it is done properly. I can tell you from my period in the hospital, because I did spend some time in the hospital, it was extremely difficult to get the three heads to work together with a common approach and to arrive at common policies going forward, or policy recommendations going forward. So I think that I'm sure that I'm correct, that sometime either in the late 80s or the 90s, the creation of an independent hospital board was contemplated. I remember Mr. McIntyre, who was our health services coordinator at the time, developing a paper with a group of people to put forward that idea. So I do think that a hospital board is important. It should reflect necessary expertise, obviously, and the required qualifications in those who serve, so that they would be able to discharge the requisite oversight that is necessary, including the selection of the CEOs. Because I hate to say that, but I think the independence in the selection of the CEO is going to be extremely important. So I believe that with a new hospital, that these changes are absolutely critical to ensure the highest standards and quality of care and the highest efficiency.
Dr. Etienne says government is on the right track and PAHO is looking forward to collaborating to see this project successfully implemented.
I know that there have been many complaints about issues of quality of care at the main hospital, which must be addressed. But quality of care encompasses a numerous number of issues in terms of investments, in terms of governance, in terms of the ensuring that your secondary and tertiary care is well developed and functions well, and there is management as well, effective management at those places. It is time that we have equal standards for quality of care, irrespective to a person's ability to pay, irrespective to your status. And I think that in a well-managed health system, your staff we will need to ensure that we have adequate, well-trained, and well-managed health staff, and that we strictly enforce the policies and the protocols, and that there is full transparency. Permit me to say that at Princess Margaret Hospital, transparency is an issue and accountability is an issue. And we cannot have high standards of quality of care unless all of these issues are taken care of.
In other developments, President of the Builders and Contractors Association of Dominica, BCAD, is hopeful that the new public procurement bill will have a greater impact on local contractors. Julian Morris has that story.
The 2021 draft Public Procurement and Disposal of Public Property Bill is meant to replace the Public Procurement and Contract Administrations Act of 2012. President of BCAD, Anthony LeBlanc, hopes the association and civil society will have a chance to dialogue with government on the draft bill.
We're going to review the Procurement Act. We are hoping that enough time is given. We are hoping that the rest of the private sector and civil society do not see procurement as only contractors' business, because it's the business of the entire private sector who want to do business with the government. And it's a business of renters of property, for example. It's a business of people who want to purchase property from the government, because all those things are covered in the Procurement Act. And I hope they make allowance for discussion, as we had in the previous one. So we are hoping that we can organize civil society and the private sector to come in as a body and approach the government and review of the act for the improvement of the private sector.
The draft bill has been described by government as seeking to modernize public procurement, underpinned by principles of integrity, accountability, transparency, and attaining the best value for money. LeBlanc says there were concerns among BCAT members regarding the Act of 2012.
The government advertised a new procurement act for review. I'm hoping it's a bit different from the draft that they had in 2016, which I've had the privilege to see. Not many other people had that privilege. And I'm hoping it's an improvement of what we have now. The Procurement Act that was enacted in 2012, I believe, Act number 11 of 2012, and became in force in 25th of January 2015.
LeBlanc says local contractors not benefiting from the Public Procurement Act was one of the main issues which affected the industry in 2020.
2020 probably was the most challenging year that we have had for a while, and it's not merely because of COVID-19. In fact, COVID-19 had some impact, but the greatest challenge for the local industry is threefold. One have to do with the method of procurement, public procurement that we've had, the impact of the housing revolution that we've had, and also a general, I would say, apathy in Dominican society now that pretty much give up, and it doesn't make sense try much harder.
The deadline for submitting feedback on the draft Public Procurement and Disposal of Public Property Bill is the 2nd of February.
You are watching the Channel 5 News. Stay tuned for more after the break.
A new in-home experience is here. All your services bundled into one simple plan. Faster, more reliable Wi-Fi so that you can binge, play, and stream uninterrupted. Unlimited flow local landline minutes mean you can talk and talk and talk. Plus the best in TV entertainment with over 120 channels and 29 in HD, all for $160 a month with the new all-in bundle. With Flow, it only gets better.
We are strong, we are resilient, and we will get through this together. But these are stressful times, and it's important to also practice good self-care. It's normal to feel overwhelmed, anxious, or afraid. But there is hope. Reach out to someone, connect with your friends, stay in touch with your community, and know that you are not alone. We're in this together. This is a public service announcement from the Dominica Red Cross.
Welcome back. Prime Minister Scarrett says he is looking forward to being among the first to receive the COVID-19 vaccine when it becomes available. It's likely that the vaccines could be available to the region earlier than the previously announced March target. The Prime Minister says he is concerned about the level of cynicism and reluctance among citizens regarding the vaccine.
I, Roosevelt Scarrett, will certainly take the vaccine, and I would urge every citizen to do likewise. It will be a voluntary offering, and the intention of the government is to ensure that it can make vaccines available to all our citizens and residents. So it's important for us to take it. I will certainly be first in line if the government allow me to be first in line to take it. And I am not really going to participate in all of these conspiracy theories, that usually come about when we have vaccines, as we've seen many times before.
Director of the Pan American Health Organization shares the Prime Minister's optimism about the COVID-19 vaccine.
By all means, I'm waiting for mine. Take the vaccines. And there are several reasons for taking the vaccines. With the emergence of mutations, because that's one of the things that happens to viruses. If there's this magnitude and level of transmission, it is easy for the viruses to mutate. Mm-hmm. With the mutations, they may well, and as we are seeing with the UK variant, they may well acquire the ability to be transmitted much easier or to cause more serious disease. So the earlier we take the vaccine, it's the earlier that we can slow down transmission and stop the transmission of the virus, and so prevent ourselves from being infected and possible death. And some people think that they are fine because they are not old or they don't have underlying conditions. But what we are seeing is more and more young people are becoming infected. So yes, take the vaccine. Governments and other community organizations should begin and continue the education of community members so that we can fight vaccine hesitancy and we can fight a lot of the wrong impressions that people have about the vaccine.
Dr. Etienne has also outlined steps taken to ensure access to the vaccines.
So the COVAX facility is a mechanism that was set up by the World Health Organization, by the Gavi, which is Global Access for Vaccine Initiative, and CEPI, which is a global disaster response agency, to buy vaccines en bloc in a pooled manner so that all countries would have access to the vaccine. Now, most of the countries of the world have invested in COVAX. COVAX made the commitment that they would be able to deliver at least 20% of vaccines to all countries and more as those became available. So COVAX is still holding on to this commitment. COVAX has a basket of 15 vaccines. As they receive emergency authorization and as they are pre-qualified and certified by WHO, we will bring those on board. PAHO is working with the COVAX facility and with UNICEF. We are the purchasing mechanisms. And so we will have access to COVAX vaccines. We know that those discussions are ongoing. We had serious negotiations with Pfizer, and the hope is that although we had said that some vaccines would be available in March, that we probably can see that advanced and to receive some vaccines earlier. But on a note of caution, you're not going to receive the full number of quantity of vaccines. And the same thing as you can see the experience in the US and in Canada, that those vaccines are coming in batches because obviously they as soon as the manufacturers can produce.
A 2-month-long Enhancing Capacities of Women and Youth in Times of Disaster project has come to an end. We again join Julian Morris with more.
The project, spearheaded by the Bureau of Gender Affairs, was launched in November to coincide with the global 16 Days of Activism Against Gender-Based Violence campaign. The locally run project, titled Enhancing Capacities and Consciousness of Women and Youth to Achieve Climate Resilience, came to an end on the weekend. Acting Director of the Bureau of Gender Affairs, Melissa Morgan, says there were several accomplishments under this program.
We've trained 83 extension service providers, women and youth in climate resilience, because as you know, many may know, post-Hurricane Maria, the government had a goal of becoming a climate resilient nation, and this was clearly articulated in the National Resilience Development Strategy and then the Climate Resilience and Recovery Plan of 2020, which kind of puts into action, becoming climate resilience. And one of the things that the Climate Resilience and Recovery Plan 2020 clearly articulates is inclusion of women, youth, other vulnerable populations on the road to climate resilience.
Stakeholders have been very supportive of the 2-month project in ensuring the objectives under this program were met.
They have been very positive and very embracing. They've been very supportive from day one. It was very easy to get people on board to support the project activities and the project outputs because, we have the Climate Resilience and Recovery Plan, but it's very important that we mobilize the community to contribute towards the plan and realize the role and the benefit for them.
Morgan believes the grassroots approach of the project was very impactful.
We've had several community sensitization sessions in Marigot, the Kalinago territory, the Dalis, We've also had several beach cleanups in other vulnerable communities, school sensitization sessions, virtual discussions, virtual panel discussions. The roadshow, I guess, is more interactive and a bit, reaching a wider population than the rest.
The Enhancing Capacities and Consciousness project was funded by the Government of Canada and facilitated by the UNDP Dominica office.
And the Eastern Caribbean Supreme Court is reporting progress in its efforts to promote court-connected mediation over the past year. The court's efforts to jumpstart court-connected mediation began in 2019 with a public education program. The court has taken a focused approach to reforming and promoting court-connected mediation.
The ability to use mediation as an alternative dispute resolution tool during the COVID-19 era took on even greater significance. After much work and a wide consultation process, we were able to issue a very comprehensive and revamped mediation practice direction in October 2020, replacing our 17-year-old mediation practice direction. These revisions facilitate improved access to justice, particularly for unrepresented parties and litigants. Some noteworthy revisions include the introduction of pre-action mediations, the expanded role of the Registrar of the High Court in referring matters to mediation, and the introduction of more user-friendly forms. It has also been tightened by the inclusion of a code of ethics and disciplinary regulations for mediators.
Digital mediation is expected to help reduce case backlog, particularly during the COVID-19 pandemic.
Importantly, the issued practice direction provides for the conduct of mediation sessions remotely using a digital platform. This development will no doubt provide a significant assistance to the court in reducing the buildup of case backlogs during the COVID-19 pandemic. Additionally, mediation training as well as public education on the availability and benefits of mediation is ongoing. Our ultimate goal is to have a regional roster of mediators which will provide litigants with a greater range and diversity of choices in selecting a mediator. This adds a new dimension, now more feasible by the use of a virtual platform. The pandemic has brought about some positive results by forcing us to see and engage in the virtual world in ways that have become our new normal, unconstrained by our physical borders. Finally, I once more urge legal practitioners to embrace mediation and be guided by the practice direction. Think of it not as a tool which conflicts with your role, but instead as one which enhances the delivery of justice.
Flow helps you stay connected to what matters. Simple plans and a better network mean that you can enjoy 7 days of unlimited social messaging, 3 gigabytes of reliable data to use as you like, 700 local anywhere calls and texts with the always-on prepaid plan, all for $29. Keep your number when you switch to Dominica's most reliable LTE network. Buy wherever you top up. Switch to Flow. It only gets better.
We are strong, We are resilient and we will get through this together. But these are stressful times and it's important to also practice good self-care. It's normal to feel overwhelmed, anxious, or afraid. But there is hope. Reach out to someone, connect with your friends, stay in touch with your community, and know that you are not alone. We're in this together. This is a public service announcement from the Dominica Red Cross.
A new in-home experience is here. All your services bundled into one simple plan. Faster, more reliable Wi-Fi so that you can binge, play, and stream uninterrupted. Unlimited Flow local landline minutes mean you can talk and talk and talk. Plus the best in TV entertainment with over 120 channels and 29 in HD, all for $160 a month with the new all-in bundle. With Flow, it only gets better.
To end the news, the headlines again. 5 women and 7 monarchs among 30 to compete in the semi-finals round of the first ever virtual calypso competition. Dominica praised by the Pan American Health Organization for its efforts in the fight against COVID-19. And legal practitioners told to embrace court mediation as a way of enhancing the delivery of justice. Feel free to access our past newscasts on our YouTube channel. On behalf of the entire production team, I am Andrea Louis, and to all of our viewers around the world, thank you so much for watching. Join us tomorrow.